the Realtor. It's my Physicians Appreciation Month. I'm super excited, and today we're here at Dr. Rani Whitfield's office, and come on in. We're here today with Maria Thomas with MBA Collision Repair, and she's one of our sponsors. So Maria, tell a little bit about your business.
At MBA Collision Repair, we service vehicles of all makes and models. We're located at 4125 Plank Road, 70805 zip code. We look forward to seeing you.
Dr. Rani J. Whitfield, a native of Baton Rouge and an active member of the Baton Rouge community, serving on the boards of educational civic organizations, including the Southern University Board of Supervisors. Utilizing his alter ego, the hip-hop doc, Dr. Whitfield has been able to share his message to young people across the globe. A leader, a father, a husband, we salute Dr. Rani J. Whitfield.
Hello, we're here at the office with Dr. Rani Whitfield. So how are you doing today, Dr. Whitfield?
I'm doing great. How you doing?
I'm doing great. Thank you for having us. He's one of our honorees. And just tell us a little bit about your practice and a little bit about, why you're in the medical field.
Well, I think I had childhood asthma and all my life. Outside, I wanted to go to the NBA and play basketball. I wanted to help people and become a doctor. I had asthma again as a child and was told I couldn't play sports because of it, and found a very good doctor, Dr. Palfrey, who's dead now, but he took care of his pediatrician and said, no, he can play, we just got to use medication to get into the next step. So as a doctor, I always wanted to be able to help people get to the next level, and if I could find a way for them to be active in their sports or their career, profession, without limitations or with medication that can help, then that's what I decided to do. So medicine's been my choice, and I'm still here.
Well, that's amazing. Bill, what are some of the things that you do here at your practice?
So my practice is basically adolescent on up. So I start usually after the child receives their last immunization. So I'm treating from 13, 12 on up. Hypertension, diabetes, high cholesterol is kind of my bread and butter stuff. We see asthma. What's really been big lately is mental health things in our community. We see a lot of anxiety, depression because of the things that are going on in our communities. People with lack of access to jobs and even health care. So seeing a diverse group of people, all different races, all different ages, starting at about age 12 on up. See a lot of dementia. Probably my two most common things I treat are back pain and anxiety. So they come in quite frequently. Everybody has a different treatment plan. I don't put folks in boxes. There are some problems in the African American community, as you well know, such as hypertension and diabetes. Probably one of the top killers of all people in our communities now is obesity. So I'm seeing lots of obesity. Some people consider that a disease, some don't. But collectively, as a family doctor, I'm on the preventative side. I'm trying to prevent people from having these health issues. So getting them plans that will have them exercising, eating healthy, getting proper rest, trying to reduce their stress, which is hard to do. You as a realtor know that's tough, but that's my goal, is to help individuals find a healthy lifestyle in the parameters in which they live to best live long, happier, healthier lives.
So you mentioned mental health in the African American community. So what's the severity of that issue?
Not just the African American community, our community in general in East Baton Rouge Parish, a lot of mental health issues are going on. I mentioned anxiety, depression, and shout out to the Dyson family. We just lost a young man, Trey Dyson, who committed suicide at the age of 13, I think it was, and I was devastated by that. I indirectly knew his mom and was connected to his uncles. We went to high school together, so that has touched my heart, moved me tremendously. So definitely prayers to his family, but I didn't even know what suicide was at the age of 13. So for somebody to take their lives, you're wondering what was going on in their life. And bullying is a huge issue, but outside of the bullying, you see anxiety. My daughter mentioned kids in her school when she's 13 having anxiety and depression at a young age. We also have seen a tick up of suicide in black males. And not just recently, this has been going on for several years, but it's now become an issue, something that's being talked about. So again, mental health issues from just the basic bread and butter anxiety, depression, which can be severe, to schizophrenia and bipolar disorders. See that quite commonly, but these people also have high blood pressure, diabetes, and high cholesterol, so that becomes a very complex patient to treat when you're trying to manage their mental health as well as their medical health. And what I always preach when I talk to folks, and I speak a lot, is about wellness. It's not just about your mental health and your physical health, but about your spiritual health and your financial health. To be well, health is just the absence of disease. Wellness means that you have your spiritual, social, physical, financial, all those things are in order. hard to achieve that at one time, but we should all be striving for those things to be well, not just healthy, but well.
Being that I work with a lot of people in the business, I know they see a lot of stress. I see a lot of stress, within the business area that I'm in. How do you think, that affects your practice, and have you seen a lot of stress?
A lot of my patients come in that have, they're type A personalities, they have stressful jobs. I see that frequently. And they can come in, we call it somatic complaints. So they're having headaches, they're having chest pain, but they've seen a cardiologist and everything's been ruled out. They've seen a neurologist and everything's been ruled out. So what's causing these somatic complaints? Yes. And it can be a result of anxiety, depression. So see it every day. And sometimes I don't pick it up that day because the patient has convinced himself that I'm having a heart attack or I got a brain tumor. So you still have to go through the medical workups and rule those things out. But you have to have some clinical acumen. You have to be suspicious that, hey, there may be something going on. There's been many times where I just said, hey, and I think the key to that is having a relationship with the patient, like you have to have with your customers as a realtor. Some of your patients high end and calling you, worrying all day. Some people you'll never hear from. When that patient comes in who never complains, is having chest pain, got to rule out that heart attack. But hey, what's going on at home? Is everything good? Is how the finances? And I don't always have the answers to it, but I was told by a very wise physician that your patients always leave feeling better than when they came. And what does that mean? Well, the headache may still be there, but you gave them a hug, you touched them in some way to make them feel better about themselves. And we're still going to be working on the problem, but you want to connect with your patients. So just rushing somebody out the room, and you can talk to them, most of my patients. I would think that very few of them tell you that I rushed them out of the room. If anything, I probably spend too much time, according to my nurse. But that's a blessing to be able to have a relationship with your patients and to connect and identify that this is not chest pain of the cardiac origin. Something's going on. It's stressful. We need to work that out as well.
So this is my Physicians Appreciation Month. So on behalf of myself and the real estate community, I just want to say thank you. Thank you for all you do in the community. And we just wanted to say thank you. And last but not least, I wanted to ask, what are some words you would give to the community about health, or any words that you would have about health in the community?
Well, first of all, thank you for the honor. This was unexpected. Didn't know that you guys were coming, and I definitely appreciate this honor. I think sometimes people forget that the doctor has issues too. So it's good when people check on the doctor. Check on your doctors, y'all. There's a song by Royce the 5'9" says, check on your strong friend. So that would be my words of encouragement. Check on your strong friend. That goes back to depression and mental health, and again, bullying. And I'm very moved by Trick Dyson. So I want people to really make sure that they're having conversations with their children. Talking to their children, seeing what's going on, and being proactive about what's going on with them in school. And the Dyson family did that. Just unfortunately, it didn't help. So we got to find ways to stop the bullying. And if I had to leave anybody or you guys with some words of encouragement, some positive words, the most important thing that we possess is our health. And so without your health and wellness, you cannot be that successful lawyer, doctor, attorney, realtor. So I really want to focus on our young people. That's my passion. That's why I'm known as the hip hop doc. They call me H2D. Come on, Baton Rouge, let's get hip hop healthy. So again, thank you guys for the opportunity, and
you're welcome.
Hopefully y'all be back next year with a check for Doctor Appreciation Month.
Yeah.